What are your thoughts on the first year of COVID-19 from February 2020 to April 2021? In other words, what happened? Why did it happen? And what's next?
Wow. That's a big question. So, an inflammation nation happened. What happened was this. I mean, now let me just stop a little away from the politics for a second, but let me just look at from a historical perspective. What happened was, we have government agencies, we have scientists, we have departments of people who study pandemics. They study, all sorts of communicable diseases, life-threatening issues that we don't know on a daily basis. Just like right here, we have Los Alamos, we have Sandia Laboratories. They do all sorts of research. We don't even know what they do, but sometimes what's on your phone, that technology was discovered there. The Mars just landed a helicopter on Mars. There's a little robot helicopter that landed. Someone here at Los Alamos just made that technology happen. So there's things that come at, that there's always someone that's working that we don't even know, right? But in public health, there's just as many people who are doing those things. And so what we have to understand is that the previous administration, which was Obama administration, and previous one before that as well, there's agency of people who've been following, Zika, Ebola, and they had a whole playbook. There's actually documentaries now, not political. They're looking at this is where did people say, where did government fail, or how did this happen, or whatever. It's because we've had a whole playbook. This is what happens, because it's not like COVID happened and nobody knew what was going on. It's like we were just looking at, well, when's the next pandemic going to come? We don't know it was going to be COVID, but this is just time and population, deforestation, whatever you're talking about. We also have labs that work with this in the United States and elsewhere. It's happened before. It's going to happen again on some level, right? Human error or human pushing on nature stress, right? And cross transmission. So when it happens, but that playbook was actually thrown away. Trump administration came in. I hate to say that. They came in, they threw it away. In the first couple of weeks they came, they said, we don't need that department. We don't need those people. Boom. They had a whole plan. This is what you need to do. Gone. So when it came, playbook wasn't there. They're like, oh, then the politics was, unfortunately here was making, in my opinion here, was making public health a political issue. And if you look at most socialized medicine countries, they did really well in terms of controlling the numbers. Okay. We are 4% of the world's population, and we have 24% of the COVID cases. 4% of the world's population, 24%. We have lost now 566,000 plus Americans since last year. Okay, which is, to me, is in my lifetime, I never thought we would have something like this as a physician. I'm too young to remember, World War II. I'm too young to kind of really remember Vietnam. I do know Iraq and Afghanistan, and those kind of things. More people died from COVID. Now, it doesn't mean that less heroism for those people who fought wars, but when we look at these numbers, to kind of just put it in perspective, because the average person is so numbed now when they look at the number, like, okay, so many people died today. It's just like the news. It's like the weather. It just passes them by, and they don't understand that that's someone's mother, that's someone's kid, that's someone's grandparents, or someone's wife or daughter that's passed away from a virus. Right? Is public health was lost. Public health was thrown away, where politicians were kind of stepping on top of, just for political gain, scientists who's been doing this for thousands of, hundreds of years. Like, this information is passing by, and we do studies, and yes, it's an evolving science. Sometimes we have to make judgments, but the judgment is still better from someone who is trained in understanding science than someone who's just trying to score political points. And the political points now is on the death of 566,000 Americans going forward, right? We have $16 trillion lost to the economy, 16 trillion due to the loss of these lives. Okay. And we have now another 3.4 or whatever, how many 4 trillion that we have to do in COVID relief packages. So we're now talking about $20 trillion is lost just because of a political aspect of like, oh, we don't want to make this sound like bad that we have to close down. We needed to hunker down. We needed to do mask wearing. We need to have social distancing. Every other country that did that really well didn't get hit. That's why their numbers are lower. Now, the problem is, since we didn't hunker down, we didn't do it well, even though we have the vaccines out right now, right? The problem is that the variants are now spreading. So now we're seeing a lower population having problems because people, again, certain states are having political issues. So what happened was that we didn't follow the scientists, we followed politicians, we made it a political issue, and now we're all suffering worldwide, globally. And it's not to say like, should we blame these people or should we blame those people? It's like, this is going to happen again, and we need to be prepared. Now, the other sad part about this whole aspect is it does come to light and I'll explain in my lecture when I give it on this conference, is using COVID as an example. Aside of social distancing, aside of half of Americans not wanting to believe it, or social disinformation of understanding how severe this condition was, 2% morbidity and mortality is still a lot of people. 560,000 people, a lot of people. Right? It's like knocking out almost all of Albuquerque. And if you know somebody from Albuquerque, it'd be sad. So it's terrible. But what we didn't understand is the ramification that Americans did terrible, aside of not social distancing, is that we're not healthy. We're not healthier than any of these other countries. And, so when we're like 46 out of 48 industrial nations in terms of outcomes of chronic disease, again, like I mentioned before, with obesity, how many people are obese in America, right? Heart disease, diabetes, lung disease, chronic kidney disease. These are all the top comorbid conditions that if you have that, you are more likely to get hospitalized and more likely to die. And so we're not doing well. But the virus also doesn't discriminate. Doesn't discriminate whether you're Republican or Democrat, whether blue state or red state. Some people aren't even interested in politics and they still will die, right? So we have to really be taking care and taking this as a serious issue. The problem is it became political, and the political aspect is now going forward. We need to start respecting the scientists, and I think we're going to have generations of questioning going forward, like looking back in retro, like right now we're still in the pandemic, we still haven't fixed it, everything, economy hasn't got up yet, but over time, when we look back, say 5 years from now, 10 years from now, there's going to be a historical look at, like, how do we even let this happen? How do we even let politicians, how do we even let public health get thrown on the wayside just for political gain off the cost of American lives? This is something that, tragically we'll look back, just like we looked at certain wars, and sometimes like, oh, that was a bad call. It might have been good at the time, maybe politically, or, but in hindsight 2020, but there was a lot of foresight that they had. There was information there. There was already experts there. There was things that we could have mitigated the loss so that so many people wouldn't have died. So I think everything went wrong. And again, more reason why people should look at an inflammation nation, because now there's another reason. So say if you don't have any of these other comorbid conditions, how can you still lower your risk of even getting a variant of any other type of virus or any other thing coming in the future? That's going to be the groundwork for people to look at the 10 steps definitively to preventing, reversing, and treating all diseases.